Alright, I want to do a quick video. It's not along the lines of what we normally talk about, but it is along the lines about stuff that's important, especially to me. And the reason it's important to me is because I have skin in the game. Here's a Hydrostone skull out of my office, and thought it'd be a good prop for this video. And it's amputation, especially diabetic amputation. And why this is important to me this year is last year, around Christmas time, my dad, who is a diabetic but seemed to be reasonably under control, got an ulcer on his foot. He had an ulcer on the other foot that we were able to heal with a friend of ours who's a podiatrist. And so I referred him, took him to this our friend that's the podiatrist, and got him under care. The podiatrist could not heal the wound. No fault of the podiatrist, but my dad has what's called tibial artery disease, which is it's common with diabetics. You know, you will get it if you are out of control diabetic at some point. All right, so my dad doesn't have enough circulation, or did not have enough circulation in his lower limb. All right, so we got referred to a wound care center. We did some diagnostic testing where they squeezed him and listened and got all his different pulses. And we're scheduled for an angiogram, and we had to do some blood work before the angiogram, and his kidneys could not handle the contrast, which is the radio-opaque dye that they use for the angiogram. Well, later that night, he collapses. Well, he lives in an in-law suite. We have an 1,100 square foot in-law suite at our house. That's where he lives after he had some strokes and other health things. So it gives him some privacy, gives us some contact, make sure that he's really not alone. It's not a problem. All right, so he collapses. He gets admitted to the hospital with acute kidney failure. Well, he's in the hospital for a week, and in that week, they do finally do the angiogram that they tried to do earlier the morning of his admittance, and they did it. And he got a surgical consult, and they said, we got to amputate the leg. Wow. He's only 67. So an amputation, below the knee amputation, is sort of a severe thing. Well, we got a second opinion there at the hospital. And the second opinion said amputate the leg. Oh God, what a nightmare. And it is a nightmare. And where we are, we're in South Carolina. South Carolina has the highest per capita amputation rate because of diabetic ulcers and diabetic complications. So statistically, we're probably, that's probably a guarantee that we're doing too many amputations. Well, my dad remained in the hospital trying to get better for a while and get his kidneys cleared up. And, this looming sort of Damocles about getting, I'll turn this over, about having this amputation. It's just horrible. It's something, it's hard to sleep. It's hard to think about, this is sort of a big thing. And for somebody that's generally healthy or has, sort of a tough guy, to have that kind of decision to make, it's just a nightmare. Well, I reached out to all my patients. I reached out to all my friends, chased down a whole bunch of leads, worked at trying to find a solution other than an amputation. Well, finally, I got in touch with a Dr. Armstrong who's runs this thing called the SALSA. It's the Southern Arizona Limb Salvage Alliance. And he's a professor at the University of Arizona School of Medicine. And I think he's a vascular surgeon. So I wrote up a narrative of what we had done and what the case was and what we're trying to do. And Dr. Armstrong responded, and thank God he. There's another guy, and I'll tell you about him in a moment. And he's a prime mover, and I'll tell you why he's so important. Radically different approach. Dr. Armstrong has a website called toeandflow.com. TOE and ANDFLOW. Toeandflow.com. So most of these diabetic amputations and foot issues, it's a circulatory issue. Well, he said, well, he thanked me for my concern, and you know, he was very appreciative that I was trying to find a solution for my dad. And he said, well, luckily for you, not too far away are two of the best vascular surgeons I know. And one of them is John York. So John York, medical doctor, Greenville, South Carolina, part of the Greenville hospital system. And his office is the Vascular Health Alliance. Vascular Health Alliance. So we started communicating by email, and Dr. Armstrong had forwarded the narrative and my concerns to Dr. York, and Dr. York replied and said, you know, he'd love to take a look at the file and meet with my dad and see what could be done. Okay. So we scheduled, and this is it's a 2-hour drive away from where we are. So we scheduled an appointment, and we go and take my dad to Dr. York. And Dr. York did an evaluation and looked at the angiogram from Columbia and said, well, you know, doesn't look really good. We could do the amputation right now. We could not do anything and then ultimately have an amputation, or we could do a surgical wound debridement and hope it heals. All right, so in the car on the way home, my dad and I had a conversation, and that ended up being, hey, we're going to do surgical wound debridement. So the next day I called and we scheduled a surgical appointment at the Greenville Memorial Big Hospital, the old hospital. And when we had that, went up there for that. Extremely professional, could not have been a better experience. And I'm not a medical guy, I'm not a pro-medical guy, especially for elective stuff. You know, I say that in my practice and in my life I have knocked many a scalpel out of many a surgeon's hand in my community on purpose. And you know, look at you know, saving people from that is a part of my life. So I'm not a big medical person, but in this case, full on, could not be better. So my dad has a surgical wound debridement where they cut away all the dead tissue, and they had to remove a bone in his foot that had gotten infected since his hospital stay. And Dr. John York came out to speak to me in the surgical waiting area. And he said, well, you know, your dad did really well. He slept through the procedure. He bled a lot. And he bled a lot. So I think maybe there's more flow there than what the angiogram from Columbia would indicate. And it was, you know, the way they did it was not how we would do it. So I would like to keep him, admit him to the hospital, do an angiogram on Monday. Well, they didn't do it on Monday. They ended up doing it on Tuesday. And I was very concerned because I had to return to my life in Columbia and was trying to manage things from a distance. And I found out that he was having a 4-hour angiogram. So what happened? Why did it take 4 hours? Well, it took 4 hours because they have this guy, Dr. Gray, who's affiliated with Dr. York's group, who did, I think, balloon angioplasty and stents in my dad's tibial artery. So they fed a wire in through my dad's groin and the femoral artery all the way down to his lower leg and opened up a number of restricted spots. Basically, they turned the clock back 25 years on his blood flow. Crazy awesome. Crazy awesome. We're talking best medicine that you could get. And we're talking answer to prayers. And my dad's been on prayer lists at a number of churches, and you know, of course, we're prayer warriors at our house. But master class skills, and even being a sort of an anti-medicine person, these doctors are unbelievable, and their whole attitude, their whole goal, you know, it's all about saving the foot. It's all about revascularizing the foot. It's all about fixing this. It's all about returning somebody to their quality of life. All right, so hi, head. Say skull. Skull.
Eye.
You got eye sockets. Well, anyway, so we have a co-conspirator here. Anyway, My dad has had 2 applications of laboratory-grown skin grafts, and the wound is, you know, 1/4 the size it was. The surgical wound is 1/4 the size it was, and he's healing, and we've got his diabetes under the best control it's ever been. So, Dr. John York, Greenville, South Carolina Hospital System is a limb saver, and so far he saved my dad's leg, and we're very happy, could not be happier with that. And Dr. Armstrong, if you have information or want to know something about the revascularization of the diabetic foot, and internationally, you know, in the UK they have a horrible problem with this too. Check out his website, toeandflow.com. Also check out the Southern Arizona Limb Salvage Alliance, SALSA. And Dr. John York, for us, has been the prime mover and really a hero in saving my dad's leg. And his phone number for his office at the Vascular Health Alliance. Are you stuck?
Yep.
His phone number is 864-454-8272. That's 864-454-8272. And I encourage you, if you know somebody that's scheduled for amputation or has a diagnosis that they need to amputate a lower limb because of some diabetic complication or some vascular complication, I would immediately call the Vascular Health Alliance and talk to Dr. John York, medical doctor, and try to get them seen. Hope this helps. Just trying to find a good way to get this out there so that sort of give you a shortcut so you don't have to suffer like we did. Number 1, not knowing. Number 2, not having a solution or a pathway. So again, greatest thanks in the world, that, you know, as much as we can thank anybody, to Dr. John York, medical doctor, Greenville, South Carolina, and to his practice in the Vascular Health Alliance. Again, that number is 864-454-8272. Good luck if this is somebody, you know, you're suffering, somebody you love is suffering. There are answers other than amputation.